Welcome, everybody, and thanks for joining us today for WHO Europe's first ever Twitter Space. My name is Banu Bhatnagar. We are at the annual WHO Regional Committee for Europe, which is WHO's highest decision-making body, where representatives of 53 member states meet to shape political action for better health in the region. Today, on the second day of the event, conversations about behavioral and cultural insights for health are coming up. But what does that mean, you may ask? Well, we have two experts who can enlighten us. Professor David Halpern is the CEO of the global social purpose company, the Behavioural Insights team, and Katrien Bach-Habersaat is WHO Europe's regional advisor on behavioral and cultural insights. Thank you both for being here. David, coming to you, how do you think BCI kind of comes together with health specifically?
Well, it comes in two main ways. First of all, in terms of clinical practice, a pill treatment's no use if your patient doesn't take it, right? Or a screening program's no good if your patient doesn't turn up. Even a vaccine, right? A vaccine's not a vaccination until someone says, yeah, you can put it in my arm. So clinical practice is very strongly affected actually by behavior. But the bigger win is that by most analyses, the majority of years of life lost, healthy life lost especially, are to do with essentially behavioral, lifestyle, cultural factors. So why would we wait for the health problems to arise? Why wouldn't we go upstream and try and prevent them? Otherwise, you've got healthcare systems that are perpetually just picking up the pieces.
Could you tell me a little bit about one or two initiatives about because I know you've worked in the BCI space for quite a while, so maybe one or two initiatives that you've done either for government or others on behavioral and cultural insights.
But how can you use it? Lots of practical examples. So let me give you a kind of clinical and also, if you like, broader public health. So famous examples are even doctors are human beings too. So an issue, antimicrobial resistance, a huge issue, keep the drugs working. We ran a trial a number of years ago now, replicated since several times over, which is what happens if you give doctors who are overprescribing antibiotics relative to others feedback about what their peers are doing. And hey presto, it reduces their overprescription rates. And indeed, if you do at the individual level of doctors, you get really quite a large effect of 12% reduction. And incidentally, you can adjust it on particular groups. So by giving feedback with respect to your prescribing rate to different ethnic groups, for example, you can dial it up in one area or down in another. So it's a beautiful example of behavioral and cultural in action. And the same would be true, simple examples about giving patients timely prompts so that they don't miss appointments, and you can get 25% reductions in missed appointments, etc. Checklists, there's a long list of these sorts of examples. And then, of course, says, well, what can you do about going upstream? I mean, a basic problem is that for many of us, we live in a world where it's easy to live unhealthily and it's quite hard to live healthily, right? In terms of the choices that are available to us, diet, exercise, etc. And so the question is, what can you do on that? You can both do individual level prompts, like, smarter versions of Fitbit to give you feedback relative to your peers, etc. But the bigger wins tend to be ones that not only cue your own behavior, but change the world around you. So a good example would be front of pack labeling in relation to nutrition, as say the French or Singapore have used Nutri-Scores. They are far, far more effective, not only at driving individual behavioral choices to healthier options, but in turn, what they do is they drive producers to make their food healthier. And in fact, that's what does the heavy lifting, is that the world becomes easier, even if you don't attend them to the labels all the time. The food has become healthier. So that's a really good example of large-scale behavioral science in action having quite a big impact in the world.
Wonderful. Thank you so much. Thank you, David. So let's go back to this question about why WHO is interested in BCI.
Well, I think the case examples that David just mentioned are really compelling. We have some persistent health challenges in our region that involve human behavior. In low uptake of vaccination, overuse of antibiotics. We've got young people smoking, drinking alcohol, obesity, low uptake of cancer screenings. I can mention many more examples of health challenges that involve human behavior. And with behavioral and cultural insights, we have an opportunity to apply rigorous methods and evidence to explore those behaviors, those challenges in depth, and to address them. And that's an opportunity I really think that we should take in our region. We need an action framework because that way of working is really still underexplored and underused everywhere around the world, in our region including. And the best place to start is to work together. So that's why we've been working together with countries over the last years, all of the countries across the region, and a long range of partners to develop this action framework, which sets the course for our work in this field for the next 5 years. And honestly, I can't wait to get started.
Super, really good to hear. Actually, I'm going to stick with you for the next question, because WHO Europe, I know, is increasingly integrating BCI work, behavioral and cultural insights, into our emergencies work. And of course, we are experiencing multiple emergencies in our region and indeed the world. So can you give us some examples of how that works and why it's important?
That's true. We are increasingly working to integrate behavioural and cultural insights into our emergencies work. I think events over the last years have made it glaringly clear that wars and pandemics and disease outbreaks are also very much about understanding people and understanding the barriers that they're facing. Pandemic, of course, it's in many ways all about behaviors. It was about wearing a mask and keeping physical distancing and accepting vaccination. And we work with 30 countries across our region. They use the tool that we developed with the University of Erfurt in Germany. And they use this tool to get behavioral insights on population behaviors and perceptions and well-being to inform their response. And we established a community of practice of those countries so they could work together also and share and learn from each other. And that's been really, really useful. But if we look at more current examples with lots of refugees who need to access health services in completely new environments under really difficult circumstances, we're currently working with 5 host countries to do research to understand refugee health access and health needs, to help inform how those services can be provided in those countries. Monkeypox, of course, is also about protective behaviors, about accepting vaccination. And we're currently working on a policy brief with some considerations on applying BCI for that area as well.
Fascinating, and it's really really interesting to hear about the really developing link between behavior and health outcomes. I think it's a fascinating space. So we're sort of getting a little bit to the end of our conversation, but I have a final question for you both, and one that might be slightly provocative, but would love to hear your thoughts. BCI has sometimes been criticized as just a fancy word for kind of smart marketing, or maybe a way of influencing people without them really being aware of it. And even if it's health outcomes, people don't really want to argue with good health, right? But maybe they also don't want to be told what to do. So, David, if I could come to you, how would you respond to that criticism?
Well, it's an important one. There's several things in there. One is it all new? Of course it's not. I mean, particularly around communications, for many years, public health professionals on smoking and so on have used what you might call behavioral science, for example, graphic labels and so on cigarette packs and various other restrictions going well beyond communication. Another reason, frankly, that government gets pulled into it is, if you think about cigarette companies, there are lots of people who are out there you might call behavioral predators, or trying to get you to do things. So at the very least, you should be in the business of leveling, the playing field. But beyond that, are there questions? I mean, in the US, it tends to be discussed about people like the idea of nudges because they're gentle and they give you a prompt, but they don't force you. You can override them. But I mean, our own view is a deeper point, really, is in the end, is you're trying to empower people to shape the world that shapes themselves. So we're quite big believers, not just in it being, elite saying, literally, the doctor tells you should do this thing, they will know more. But also that you should use kind of ways of getting to the public and saying, how would you like the environment to be? When you get to the checkout in the supermarket, do you want it to be all sweets and chocolates there? Or would you rather when you have something else, right? How do you get to choose and shape the world, which in turn shapes you? And that's really one of the most important things I think WHO and others can do, is to provoke that kind of discussion.
Thank you so much. So, Katrine, how about you? How would you respond to that criticism, the so-called nudge effect?
Notch effect, fancy words. You know, as I said, we have some really compelling challenges in our region, and we're nowhere near the place where we're utilizing the potential and the power of applying behavioral and cultural insights to address them. I mean, are behavioral and cultural insights the answer to all of our hopes and prayers in health today? No, of course not. Are they part of the solution? Should they be integrated into how we address these issues? For sure they should be. They're not just some fancy sprinkle on the cake. If they're done right, they're a really good investment. Of course, if you want to call that fancy, it's quite okay with me.
That's great. Thank you so much. And I feel like we could actually keep talking about this, but maybe this is a good little teaser for our listeners and to check out more about BCI on our website. That was extremely enlightening. So thank you both very, very much. BCI really does seem like it has great potential for application in everyday life, and it was great to hear some of these real life examples. I'm certainly looking forward to seeing how this field continues to grow and shape our health policies and systems in the years ahead. So, as I said, a lot more available on our website. Also on the BCI Hub, it's a knowledge hub dedicated to sharing insights and good practice on behavioral and cultural insights, which you can find at bci-hub.org. Tune in later in the afternoon as well, where we will talk about long COVID. What are the symptoms? How many people are affected? And what can be done to support them? And join us tomorrow as well. We will also talk about digital health, the opportunities, challenges, and why we need a regional action plan on digital health. Thank you for listening. Goodbye.